Norway has been copying the English NHS Talking Therapies, or we used to call them IAPT services. They started their program in 2012. They've got about 60 of these services now. And they've done a couple of really nice studies recently on this. So when they were setting up the latest set of services, a pair of services, they decided to do it as a randomized control trial. So they randomized patients either to usual primary care for their mental health problems, including access to a psychologist or psychiatrist if appropriate, or to joining the IAPT type service, which they call prompt mental health care. And they've already published a trial on the clinical outcomes. The recovery rates are about twice as high if you went into the IAPT type service than if you stayed in primary care. But more encouragingly, they are now just finishing the write-up of a study, and I was at a conference last week where they were presenting the results, where they have followed patients up for the next 3 years. And what they find is that those people who had the NHS Talking Therapies type service were more likely to be employed and not receiving welfare benefits. And also, and this is something unique that you can do in Norway in terms of where the government provides access to data, the people who were treated in the NHS Talking Therapy services had a higher average income over the next 3 years. So you can do a calculation which economists are very interested in, where you calculate what you call the benefit to cost ratio. So you look at the greater income of the people treated in the talking therapy service versus primary care, normal primary care, and then you divide it by the extra cost of delivering that new service. And you find the benefit to cost ratio is about 3.6. So, if you put in $1 billion on your mental health service, the return to the economy will be $3.6 billion. In other words, effectively treating mental health allows you to grow the economy, something that almost every country in the world is interested in.